In today's episode, you'll hear from Dr. Didi. Dr. Didi is located in Kennesaw, Georgia. She obtained a master's degree in international health policy and management from the Heller School of Public Health at the University of Massachusetts. She also graduated from the University of Benin Medical School and completed her internal medicine residency in Harlem at Columbia University in New York. She continued her training with a nephrology fellowship from the Medical University of South Carolina, and she's currently an adjunct professor at the Morehouse School of Medicine in Atlanta, Georgia. Dr. Didi is board certified by the American Board of Internal Medicine, and she's a fellow of the American Society of Nephrology. More importantly, she is an international medical graduate. Having completed medical school in Nigeria, Dr. Didi's episode focuses on the key questions you should ask when looking for a mentor, how to find a mentor, how to network, and also key tips on how to advance your career. She also offers rotations in primary care, internal medicine, and nephrology in Atlanta, Georgia area, and has extensive expertise as a public speaker, TEDx talker, with a strong focus on prevention. Now, onto the episode. The IMG Roadmap is the only podcast dedicated to coaching international medical graduates in success blueprints for this unique pathway. I am Dr. Nina Loom, your host, a previous IMG turned hospital medicine physician, healthcare administrator, speaker, and coach. I empower, encourage, and equip you with actionable steps that you can take towards the residency position of your dreams. Hey guys, and welcome to another episode of the IMG Roadmap podcast. I am so excited to present to you Dr. Ndidi. She's an internist and a nephrologist, hailing all the way from Atlanta, Georgia today to join us on the IMG Roadmap podcast. Welcome to the show, Dr. Ndidi. How are you doing?
Thank you. Thank you for having me, Dr. Nina. This is so awesome. I'm so glad to be here.
It's my pleasure. So before we got on the call and started to do our recording, we were just talking about, some of the things that IMG's experienced now and kind of reminiscing on maybe how far removed sometimes we may feel. But a lot of our conversation today really is just about encouraging someone else, sharing our stories. Hopefully they can learn from our lessons and learn a little bit about our past and how they can do things differently. So I would like you to let the audience know a little bit about you. Like, where do you come from? Where do you live? What kind of medicine do you practice now? Tell us more.
All righty. My name is Dr. Didi. I go by Dr. Didi because my real name is really long and people have a hard time pronouncing it. And I'm the founder of YoungerSelf MD Medical Clinic. And I also have a health and wellness part of it attached. I'm an adjunct professor of a couple of universities and a mom, a wife. And I call myself a physician entrepreneur because I've been involved in several businesses. And I am a TEDx speaker. I love to speak and share my knowledge, and I love to mentor. I also have a lot of mentees that I train.
Awesome. So you're the perfect person to be on the podcast because you have background in academics, you have background in private practice and entrepreneurship. And I think that that's the part of medicine that a lot of IMGs don't get to see is after residency, the possibilities are endless, right? Like we don't have to be stuck in one path or in one narrow box or fit into the box. We can do the things that we like to do and we can do fellowship and still pursue these other things that we still enjoy to do. And so we're going to get into a lot of that today. But let's just start out with giving us a little bit of background as to where you went to medical school. And are you an IMG?
I am an IMG. That's why I qualify for this podcast.
We just have to set it up though, because some people are listening and they're like, she can't be an IMG. She's doing all these other things. So
let's just get this straight. I told you before the beginning of this podcast that I hope I wasn't going to discourage anybody. And Rome wasn't built in a day. So I didn't just do all this in one day. It has taken a lot of time. But yeah, I am an IMG. I graduated from the great University of Benin. And do you want me to tell you my whole transition? I came to America and went to study a master's in international health policy and management. And I worked in a research capacity for a couple of years as a senior research associate, writing papers and publications. And, my calling was really to go back into clinical medicine. So I went back and did my USMLEs and, got the ECFMG certificate. And I was blessed to have matched because that was a very, very difficult time. I mean, grueling. And I think they've changed the scoring system now, but in the past it was, percentile. Do you know what it is now?
Yeah,
It's
so
changed quite a lot.
it has changed because when I took the test, it was a percentile, which was a 2-digit score, and now it's a 3-digit score. So they eliminated the percentiles and they only do 3 digits. And I think the step one is a pass fail, and step two is
Oh,
3 digits.
exactly. That's the change I remember. So I think, yeah, one of my mentees told me that it's now fail. And yeah, so I did the steps while I was working. So I was working as a research associate in a hospital in Boston, Massachusetts, while my schedule then was really tough because after work, I would get on a train to the library and study for a couple of hours and then get back home in the evening. And so I was fortunate to pass and have good scores. And I was able to match the first time because that's something I really wanted to try to do. I wanted to prepare as much as I could so that I could just match.
Yeah.
Because a lot of people that were going through the same thing were not fortunate to match. And they shouldn't be discouraged because those people have eventually matched. It's just that it takes a lot more to keep repeating the whole process. It's very expensive. You have to apply to all these places and trying to get interviews and traveling. And if you don't have relatives or friends, then you'll have to pay for hotel accommodations. And so, yeah, it was a kind of a stressful time, but it was worth it in the end.
Yeah. And so today, tell us what your residency training was in and your fellowship training and where you trained. Give us a little bit of background.
I went to Harlem in affiliation with Columbia University in New York. That's where I'm at to do my residency in internal medicine. And I went to do my nephrology fellowship at the Medical University of South Carolina in Charleston.
Okay. And
Yeah.
and when you finished your residency, were you already like set on doing a nephrology fellowship, or was it something you had to think about? Like, or did you go through residency knowing I want to do a fellowship down the road?
To be honest, I've had many different passions along. You know how when you're in this rotation in residency, you'll be like, oh, this is what I want to do. It really depends on who your teacher or mentor is, right? If you're in a cardiology rotation and you're having so much fun, you're like, oh, I want to be a cardiologist. But I kind of narrowed it down to pulmonary and nephrology. Those were the two fellowships that I applied to. And I got the nephrology, which was great.
Yeah. And when you were going into residency, did you apply into just one specialty or did you do like two specialties, or were you kind of set on
No.
internal medicine?
Yeah, I just wanted to do internal medicine because originally when I graduated med school, I wanted to do OBGYN. I like, as a woman, I was more interested in women's health. But, the way it's practiced here, I think is different from how it's practiced where I fell in love with. So I decided to adjust my preferences based on the environment.
Yeah. Yeah, no, that makes sense. So, in current day, tell us about how, your residency and your fellowship meshes with what you do today. You mentioned being in private practice and also doing some adjunct professorship work. So, paint the picture for us. We want to know what life can look like at the end of all this hustle.
And it's not compulsory. Everybody doesn't have to do a fellowship. And I just did one fellowship. Some people have after the fellowship, they go and subspecialize and you can just keep going and going and studying. So it's based on your preference. What are your goals and what do you desire? And my path. So after I graduated from my fellowship, I really needed a job that was flexible because I was also raising a family. I thought I liked the hospitalist model, which was 7 on, 7 off. And initially I liked it. But after some time, and it varies. So some hospital systems are more flexible than others. And what I found out was that when I was in some hospital systems, even though the shift is 7 to 7, when you finish your work, they were so organized that they could pair people up in teams, and some people can have long days, others can have short days. Whereas in some other systems, it's 7 full days, 12-hour shift. And if, God forbid, if you have a 1.5 hour commute to and fro, that's like a 16-hour workday, right? Or whatever. So, and that's where I found myself in at some point. So that wasn't fun too. It was a little bit difficult to coordinate the schedule. So I adjusted and then, started doing a little bit of locums, which gave me a more flexible schedule. And I was doing some locums nephrology on the side, working with, you always have to get mentors. I value mentorship a lot. I think it's a very necessary thing. I want to be mentored and I want to mentor others. So yeah, I had one and I was working in his clinic on a part-time basis. And how did I end up in private practice? Well, I felt like I had a lot to offer. I wanted a little bit more flexibility. I wanted to hone in and develop my entrepreneurial skills as well. And yeah, so that's why I'm here now.
I love it.
And
Yeah, it really does. I'm soaking it all up. I'm like, I love this. I want to
but
talk to
you
you
know,
outside of the podcast. Yeah.
this story has been going on for almost 20 years, right? Like,
Yeah.
it didn't just happen in one day. So, you
Yeah.
do something, you try it out, you might not, you don't have to be in one, you may get the perfect job that,
Mhm.
suits you and you want to stay there till you retire, but you might want to try and do other things too.
Yeah. No, absolutely. So, let's talk a little bit about something you mentioned earlier, mentorship. And I like that beyond just mentoring others, you said something that's really important is being mentored as well.
Yeah.
Can you share with our audience what mentorship means? And I'll tell you why I want you to talk about this. I get messages sometimes from IMG's on the IMG Roadmaps Instagram page, and which is our podcast page on social media. And I get messages like, "Can you mentor me?" And that's the email, right? It's, "Can you mentor me?"
That's like
And
saying,
tell them what that translates to, because I
it's
usually don't know
like
where to start.
it's like saying, are you in what country are you in? Or, or in and amongst all the different countries in the continent. It's like so broad. That's my point.
Yeah.
So there's several schools of thought. Some people feel like you should just have one mentor for the rest of your life. And other people, because I am not in that school of thought. I feel like, I identify things I want to develop in myself. And I look for people who have those values and attributes that I'm looking to learn or gain. And I offer them something in return. So it's not just me going there to take, 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 take. You also want to give, 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 give as much as you can. So tell them where you are, all the things you've accomplished, and where you want to go, and how you have to, as a mentee, you have to tell your mentor what you want to gain. So
Mhm.
when people approach me, when they send me those random letters like you were talking about, I get those emails as well. I always reply by saying, okay, what are your goals? What do you hope to achieve from doing this rotation with me?
Right, right, right.
And
Yeah,
that way
yeah,
we can determine if we're a good fit. If somebody is coming to tell me that they want to do neurosurgery, for example, and I'm a nephrologist, how can I help you? I'm like,
right.
I cannot tell you what courses it's not really a good match. That's just an example. Or
Yeah.
some other things, you know what I mean? Yeah.
Yeah. So your recommendation for our listeners who are seeking mentorship is to, one, be clear within themselves about what they're looking for.
Correct. Yes.
And then two, I also heard you say to be ready to give as much as you take.
Yes. Give more than you take.
Give more than you take. I like it.
Give more. Yes.
Yeah.
Leave. My thing is, by the time you're leaving your rotation, your mentor will appreciate you and they will miss you. And, it might even turn into a long-term relationship, long-lasting relationship, which is what you want to do. Because you
Right.
don't know, the world is so small. In the future, you might need them again for recommendation letters or whatever. So it's
Yeah.
always good to not burn bridges and do your best to keep a good impression and be helpful wherever you
Yeah.
find yourself.
And, I think we're just going to park at this mentorship topic because it's such an important thing. And before we came on the call, we were going over all these questions that we were going to go over, and we'll get there. But I feel like it
Okay.
would be amiss for us not to really get deep into this because, in a sense, even as I'm interviewing you, I am being mentored by some of the things that you're saying. Now, it may be a short term, maybe it's more of it could be an inspirational thing for me because maybe I don't have the time with you to make it a long lasting relationship. But there's something I'm
We
learning
can
as I'm
change that. What are you talking about? We can
right.
change that.
Absolutely, I'm for it. But as I'm talking to you, I'm learning some things and I'm being inspired and I'm like listening and I'm like, oh wow, this is something that I can do better at. So I know the listener also is going through that same process in their mind, but they're probably even more confused than us in the sense that they're like, where do I find a mentor? How do I find a mentor? Okay, I know I want to do family medicine, pediatrics, internal medicine, but how? I'm from Nigeria. I just moved here last year, or I'm from Cameroon like myself, and I just moved here last year. Where do we find these mentors? What would you say to that?
Well, where there's a will, there's a way, isn't it?
Yeah, right.
Well, so after you have decided that you want a mentor in a particular thing and you want to learn the skill, you have to pinpoint what skill it is that you want to learn and do some research. You have to Google and check the internet for people that are experts in the field. I remember when I wanted to do pulmonary, I rotated with a very famous at the time pulmonologist. Yeah, I met him through another doc. I just asked, sometimes. So I was at the ACP conference this year, I think, and one lady just walked up to me. She hasn't matched yet. She's doing her exams. She just walked up to me and said, "Hi, my name is," I can't remember her name, and I would really appreciate it if you could give me some advice on how to do it. So that's one way to do it. You could just walk up to people who you feel maybe she had done some research about me. I don't know, but that's always the best thing. Identify what you want to gain, then look for people who might be approachable. And you'll be surprised that they'll be approachable. They will respond to you. And if they're too busy and you'll the first no does not mean never.
Yeah.
So no just means not right now.
Not right now.
Right. So don't give up and don't be discouraged. Just try again a couple of months later.
Yeah. So two things I learned from what you just said is one, sometimes you approach the mentor and the mentor does not reject you, but may just have other things in their life that are a priority at that time. So they're
Correct.
not available to care for you in that moment. But they may be able to do it down the road. So I think it's also fair on the side of the listener who's listening to us today and thinking, how do I get this mentor? Well, you're going to approach people. Some are going to say no, or they may say not now, but that should not define, it's not a rejection onto you. It is a factor of where they're at in their life and the fact that maybe they don't have time to allocate to helping you in that moment. But another follow-up question that you could ask is if they have someone else they could direct you to, or if you could circle back in a month or 2 months or 3 months, or whatever the case may be. Another thing I heard you say is, where do we find these mentors? We almost have to remove ourselves from our rooms, right? And go out into the world. And one of the best places you can do that is, one, you identify the specialty you're interested in, and then you look up their national conference, because they're going to have a national conference once a year.
Correct.
In the country somewhere.
Yeah, national conferences. They have local conferences as well. Any conference where you're going to have a gathering of all those people that you need. You go there and be nice and approach it from how you can help them, no matter what skill, even if it's if you're good at social media, for example, and if you're good at other skills that are not related to medicine, you can say, "I'll be happy to assist you with this. I'm very good at that. And I would really love to learn this from you. I want to shadow you." And you know what I mean? Show them that you're not going to, because you're not going to be an extra burden. I always want it to be a mutually beneficial relationship.
Absolutely. And I think it takes the person also being intuitive and emotionally intelligent within themselves, because you as the applicant or the future resident physician has to have done your research on who is going to be at that conference. Potentially, you don't know who, but if, let's say, I'm in Georgia right now and I was interested in internal medicine, what would I do? I would go to ACP's website and find a physician. And I would search all the board certified internal medicine physicians in that zip code that I live in. And for me, that could look like, emailing or mailing. People forget, even written letters. You can write a letter to a practice and put it in the mail, and that person will see it. And in your letter, you put a number or an email that they can respond to.
Yeah. I think I prefer email though.
Right.
Because who's going
to read the paper?
Oh my God, just send the email. And, if they have time to respond to you, the email can get buried amongst all the other emails that they're receiving. So don't send just one email. Send multiple.
Right. And what time do you recommend? So if someone, because I get this question all the time, it's like, well, if I send an email now and she doesn't respond, do I wait tomorrow morning, 3 days? I usually say give it like a week or two.
Yeah, before. Yeah. I think that's a good time frame. A week or two is good.
Yeah. I just feel like, I'm trying to read my email once a day now. It's not working. But I'm trying to, I did this thing where I deleted the email app from my phone. And so I have to check it on the laptop. And I'm like, I want to do it like 3 p.m. every day, but it's not possible, right? Some days at 3 p.m. you're seeing patients. And then other days at 3 p.m. you're not seeing patients. But yeah, they may not see it for many reasons. It may just be that there's so many work modules that those of us that are employed physicians have to do. There's so many other things that, family obligations. So if you don't get a response the first time, don't be discouraged, right? Like, just try again. All right.
Correct. Yeah.
I wanted to ask you this question. You mentioned in the beginning that you serve as adjunct professor for a few medical schools. So tell us, what does that look like and how do you work with these students?
Oh, well, it varies. You can do it and if you want to just do it in the research capacity, show them how to write papers and publications. Or in one case, I'm a community preceptor. And what that means is I go to the school and teach them. They have different things like Huskies and, exams. I participate in those and give them feedback. And they also come to my clinic for rotations.
Okay. Okay. And can you share with us more about the rotations that you offer at your clinic?
Yeah, it really depends on what, I'm an internist and a nephrologist. So I also have an interest in integrative health and wellness. So we can, it depends on what they want. Those are the broad categories. And we can talk more in detail if they reach out. My email is admin@youngerselfmd.com. I'll say that again, admin@youngerselfmd.com.
All right, guys, we're going to put her email in the show notes as well so that you can do a one click and send her an email. Okay. So there we go. Now, do you work with only medical students or graduates as well who are looking for clinical experience in internal medicine? Or do you also offer these services? Are they primarily just for med students or graduates?
No. I mean, like right now, I have a med student and she's doing her, I don't know what you call it when you're in between, when you're between writing your exams and your interviews and all that. She's already graduated, she's in between. So, yeah, we evaluate on a case by case basis. And I want to make sure that I'm offering and giving value as well. I don't want you to just come there, waste your time and live with no knowledge or no mentorship.
Yeah. No, that's awesome. And for listeners who are interested in rotating with you, they can reach out to you at that email, correct?
Yes, that's correct.
So I think what I want our listeners to know is you have a physician, internist, nephrologist, entrepreneur that's on today on the podcast, literally giving you a contact point if you're interested in rotating with her at YoungerSelf MD, and we'll have all her contacts in the show notes as well. So I was looking through on the internet, kind of just researching for our session, and I noticed that you did this TED Talk, which was titled The Healing Power of Curiosity Prevention. So we have two questions. There are two questions here. One, we want to, obviously, I'll put the link to the TED Talk in the show notes, right? And I want you guys to go watch the TED Talk. But how do people get on TED Talks, especially if they're an IMG? Because that's like next level stuff. Because a lot of us IMGs are thinking right now, first of all, residency is so far away. Fellowship is so further away. Private practice is even further away. How do you even get on that stage, right?
Yeah, exactly. You have to not try to do everything in one day. That's what I started by saying, that all these things I've achieved have been over years. So, the TEDx talk, I came up because I started speaking. When we go through med school and residency, we're presenting, right? Day in, day out, we're doing all sorts of clinical presentations, and we're natural speakers. Physicians, I don't think they realize that they're just natural speakers. Right. And, we just have to pull that out. It's kind of a different skill, though. You're not going there to give a H, obviously, but history and physical, for those who don't know what HMP is. But so there's some style to it, and how to get it. There are different ways you can apply. But if you're at the stage where you have not matched for resident, that's not the priority right now. You're at this stage, the priority, you can put it on your to-do list. So if you have many goals and ambitions and wishes, just write them down, all 50 or 100 of them, and then prioritize the first two. For people who are trying to match, I think they should focus on all the things they need to do to pass their exams, get really good scores, get great recommendation letters, do their research to find out IMG friendly institutions that they can join. So that should be their priority. And that is a lot of work, studying to get the good exams and trying to pass everything at once. That's a lot of work. And when they're done with that, they want to now develop their profile as a speaker. Applying for the TEDx talk is not very straightforward. It's also a process, because you just go on their website and then they have different stages. You can get a coach to help you with that. If you don't have the time to do it, they can walk you through how to get some of the contacts that you might need.
Yeah. Okay, that's good. I think it's aspirational for a lot of us IMGs. Is we have dreams, we have aspirations, but I think it's important when we see other physicians who identify as IMGs that are doing some of the things that we also dream of doing. I think it's very inspirational for our audience to see that. And like you said, Rome was never built in a day.
No.
time and it takes practice. It takes diligence. It takes all this work that you've done from the Heller School of Public Health all the way down to Harlem, Columbia University, and nephrology training in South Carolina, being an associate professor for Morehouse School of Medicine. I mean, all of this took time, right? But I think that our audience likes to know that it's possible. And so, in that same light, I wanted to talk about some of the challenges that you met on your way to this career that you seem to have found your niche and how you enjoy to practice. But I'm sure there were some trying moments, right? Especially before becoming that resident physician that you ever dreamed of. Can you share with us how you dealt with some of those challenges and what they were?
Oh, yes. Oh, let's talk about challenges. There were challenges that we have to turn into opportunities. Well, for one thing, we are IMGs, right? So that can count as a whammy. So you have to come with stellar everything, stellar grades and stellar research experience. If you don't have one, it might be a good idea for you to get one. And I was simultaneously raising a family. I don't know if I would advise people to do it the way I did it because I had a husband and I was having kids, and it was tough because, I'll tell you one horror story. When I think about it now, I feel like, God, shoot, that was not a good idea. My son was 5 days old when I went into residency. I did not want to, just imagine this. I did not want to graduate off cycle. You know what that means, right? So the cycle, I don't, have they changed it now? It's like
June.
July to,
Yeah, July to June. Yeah, it's still the same.
yeah, exactly. So I didn't want to graduate off cycle. So I didn't take maternity leave or anything like that. I just went straight in. Luckily, I had my mom to help me take care of him, but that was not a very wise thing to do. Now, in hindsight, I see that. But then nobody could tell me, you know, because I had just given birth. My feet were swollen, the fluid retention from the pregnancy. And in fact, one of my attendants, he thought I was being unprofessional because I was wearing sneakers to work. And the reason was my feet were so swollen. Those were the only shoes that fit. I couldn't wear regular shoes because, sneakers, you can tie, you
Yeah,
can
you
keep it
like
loose and
loosen
make it
up.
as tight as. Exactly. So those were the only shoes that fit. And it was tough. And I really wanted to breastfeed this child. That was also another challenge, having to say, oh, I need to take some time to go and breast pump. And some people don't appreciate that. So it's tough. It was tough and it takes some coordination. Would I do it again? Perhaps not. I think that, yeah, well, I don't know. Maybe because back then, when you're so laser focused, maybe I would do it again. But the difference would, I don't know, but I shouldn't. I shouldn't want to be so laser focused on and do that, right? And put ourselves in harm's way.
Yeah,
Because I did have some other colleagues who waited and did everything beforehand. So it was tricky. So those were some of the challenges, having to raise the family as well.
Yeah, so let's talk about that because it sounds like if you had your baby right before starting residency, like 5 days before your residency started, so you were pregnant on the trail, interviewing and, ranking and during that whole process, right?
Yeah.
Like,
Yeah, but
yeah.
there's a long gap. There's a long time between.
Okay.
I think I was like in my first trimester. It wasn't really a
Okay, in the
problem.
beginning. Okay.
Yeah, it didn't show up at all.
Yeah.
Yeah.
Yeah. So, what is your advice for moms? Because I have a program, an online program where I do coaching for international medical graduates. And obviously, as a West African woman, I seem to attract a lot of other West African women and women from all over the world. I have women from India, Pakistan, and I have a lot of moms in that program as well. And some of them usually have this, I don't want to say guilt because that just simplifies what it is, but they struggle with, caring for their small children, sacrificing their medical career, moving to they're in the United States now, and they're having to no longer work as a physician, working on examinations while also raising a young family. It feels like a really difficult rock to push uphill. What are your recommendations for women, specifically IMGs, mothers, who are in this scenario where there were physicians in their home country. They're now in the United States, maybe for marriage, maybe for some other reason. They moved here, career, and they have young children and they're working on this process and are literally feeling like this is not possible.
Well, it is possible. I would encourage them to breathe. It's possible. People do it all the time, but then it goes back to prioritizing what you want. I was lucky my mom was able to help out. And after she, because she's a professional, she has her own life to live. Like, she said, I still have my life, but she helped out a lot. And after she left, I had a very good support system around. So that's very important. You have to, nowadays, they have au pairs that you can hire, and they're quite affordable to help you. And some other get friends, live in a neighborhood. For me, that was what really helped me. We were in a neighborhood that had a lot of other residents. And so when I'm on call and they're not on call, we could kind of work together to babysit each other's kids.
Yeah. So you
Yeah,
really
so, support system. You have to have a good support system. Right.
yeah. And
Right.
don't
Right.
isolate yourself, right? Like people need to know that you need the help and be ready to exchange. Maybe that would be a better way to put it, where you can exchange,
Right.
right? Yeah.
If you don't communicate, then they won't know that you need help. Right.
Yeah.
So don't
Yeah.
be afraid to ask for help when you need it.
Right. So these days, when you're working with your mentees in practice and they come over to work with you, what are some things that you think they can benefit from? Let's say I decide, hey, I'm going to come check out Dr. Didi at YoungerSelfMD.com and I want to schedule a rotation with her. What are some pointers that we need to know about what we can gain from working with you maybe for a month or so?
Well, that's a broad question. Again, it depends on what they want to achieve and what their goals are. I usually start by asking them to send me a list of what they want to achieve from the rotation. What are their goals? What are their wishes? Where are they? How much do they have already? What do they need? We do some discovery session, so to speak, and kind of see how we align and how we can brainstorm and help each other. So that's a very broad question. And I think it starts from us having a conversation about what you need and how I can help.
Okay. All right. And so, guys, that's your pointer right there. So when you reach out to Dr. Didi, before you do reach out, on what you need. And I'll give you guys some ideas, right? Some of the services that they offer at YoungerSelf MD could evolve around primary care, could evolve around internal medicine, could evolve around integrative medicine, kidney disease care. There's also some component of weight management and other aesthetic services as well. So if I was applying into residency, maybe my email to Dr. Didi could look like, I'm interested in family medicine or primary care or internal medicine. And so I know that going to her practice, I'll be learning about some hypertension management. I'll be learning about some renal disease management and medication management in these scenarios, what to do, what not to do. And that could count for an internal medicine experience. So these days in ERAS, they have this thing called experience section, which before you could just list your CV and be done with it. And now they want applicants to select like 3 to 10 experiences in their lives and highlight 3 of those that are most meaningful, right? So whenever I'm recommending anyone to do a clinical experience, I want them to reflect on how this could be applicable for their application into residency. And so one of the things that I can see, just kind of, giving the listener some pointers, is if I was interested in primary care, if I was interested in, kidney management or kidney disease management or integrative medicine, well, this may be a great way for me to have one experience in that specialty. And then while I'm there, look at ways that I can leverage a description that I can use in my application on the road. Because it's just not about doing experiences because you can, right? It's about being clear and having that internal clarity as to how this is going to help you on the road. So I just wanted to point that out.
Yes. And if they're interested in the business side of medicine as well, I can help show them. I do. So currently my intern is going around doing some marketing with me. And we're going to see other doctors and going for conferences together. So if they're interested in that, we can do that as well. So it just, they can learn just the medicine part, or they learn everything.
Yeah, absolutely. We like that. So as we round up our conversation, we'd like to know, what is one life policy or mantra or something that you tell yourself and something that we can take home with us and say, wow, listen to this podcast with Dr. Didi, really inspiring. And she gave us this one piece of recommendation that she lives by. What would that be for you?
Always keep moving forward. Always. And, success leaves clues. So find out people who have been successful in whatever it is you want and watch them, study them. And, as we've been talking about mentorship. And I think for me, I always remind myself, Rome wasn't built in a day. I want to do all these things. I don't have to do everything just today. I can just prioritize and pick one off the list and keep going down the list. And but I think the most important one for me is always keep moving forward, because there are a lot of things that will discourage you from time to time and, make you feel overwhelmed and you want to quit. Oh, it's, it can be up and down. But when I think at the back of take one baby step in the direction that I want to move towards, one baby step, just a small one for that day. Boom, I'm all set.
Yeah.
You know what I mean?
I love it. I love it. Always move forward. Like, I think sometimes we minimize just doing the mundane to get forward, because that's like walking is very mundane. You're literally just taking one step, another step. It's the same leg, the same every other leg, And literally, I feel like that's an analogy that we can take into our lives, is we should always be moving forward, because that's how you make progress. You're not going to go from 0 to 60 without some level of momentum on your part.
Correct. Momentum.
While you're taking those steps, you run across physicians that are going to help you go faster. You run across family members that are going to push you forward. You're going to have a church family or whatever else that's your support system that's going to help you go a little bit faster than you would go on your own, but you have to have been walking to get there. And so don't be discouraged. Keep your head up high. We thank you so much for coming on the podcast, Dr. Didi. We'll have all of Dr. Didi's information in the show notes, youngerselfmd.com. Contact us admin@youngerselfmd.com. We'll have all this down in the show notes, one click, and we'll also link her TED Talk so that you can watch Inspired and learn more about her.
Yes.
Just
thank you.
You have her contact information.
Thank you so much, Dr. Nina. This was really enjoyable. I enjoyed it. I hope I can come back again.
Yes.
To share some more information.
I think you should. I think we should do one on the physician entrepreneurship side of things, because that's something that definitely interests me as well. So I'll be happy.
Happy to.
Yeah. All right.
Okay. All right.
Look at you. I'm so proud of you for listening until the very end. And because of that, you deserve a reward. And I want you to go right now to drninaloom.com and download any of my free ebooks, whether it's for electives or clinical rotations, or even just whatever trials come your way as you navigate your IMG journey. Stay tuned for another episode coming up next.